She asks, are there tools or apps to help strengthen my vagina?
Yes, there are several options. There are Kegel weights. These weights, often shaped like balls or cones, can be inserted into the vagina. Holding them in place without letting them fall out helps build muscle control. As you progress, you move from lighter to heavier weights, enhancing your pelvic floor strength over time. There are electrical stimulation devices that provide a small, painless electrical current to the pelvic floor muscles, causing them to contract automatically. These devices can be used internally or externally. Internal devices involve inserting a probe into the vagina, while external devices are less invasive and can be worn like a pad inside your underwear. There are also biofeedback, which is a technique that allows for you to see your pelvic floor muscles in action. Using sensors and a monitor, biofeedback shows you how well you're contracting and relaxing your muscles. This visual feedback helps you understand your muscle activity, making it easier to strengthen your pelvic floor over time. And then there are also some FDA-cleared at-home devices designed to strengthen your pelvic floor muscles and treat urinary incontinence, like the Lia pelvic health system.
Wow, that's a lot of options, a lot of physical things. Are there any apps that will help?
Well, there are a lot of Kegel exercise apps, actually. They will typically guide you through different Kegel exercises, help you set goals, teach proper form, and track your progress. Some examples are Squeeze Time, Easy Kegel, and Kegel Trainer PFM exercises.
Obvious question, who can benefit from these exercises?
Well, anyone who could benefit from Kegel exercises can use these devices. They can be particularly helpful if you're new to Kegels or you need assistance in identifying and isolating the correct muscles. As you become more comfortable with these exercises, you might eventually do them without the aid of a device. But you will want to consult a physical therapist before starting a Kegel exercise plan, especially if you're unsure whether or not your pelvic floor is too tight or too loose.
By the way, it's not just for women. But in this case, it is to strengthen the vagina, but there's Kegel exercises for men too.
Yep.
Absolutely.
Yep. Correct. Men can strengthen their Kegels, so it can also help with the rate in which a man ejaculates. So, yeah, so you just, for men, it's the same muscles you want to contract that kind of like if you started peeing and then you got to stop peeing all of a sudden, it's the same muscles. But don't do it while you pee. That can cause a problem. So you don't want to stop your peeing too many times. But it's the same muscles that you would use to stop your pee. Okay. And you can do them anytime.
Okay, better mind. Thank you. Anyway, our next question, Dr. Lia. Why does my libido seem to change when I get into relationships?
It's typical for people to notice a change in their libido when they enter a new relationship. What starts as an intense, passionate connection during the early stages often evolves into a more relaxed and comfortable dynamic. The first few months of any romantic relationship are often referred to as the honeymoon period. This is that time when both partners are usually on their best behavior, trying to impress each other. During this phase, sexual desire tends to be at its highest. It's the excitement of something new and thrilling. As the honeymoon phase ends, you may notice a drop in sexual desire. This is completely normal. The relationship becomes more about companionship, trust, and comfort, rather than the constant need to impress and engage in sexual activity.
You know, this honeymoon phase can apply to a lot of different things, like buying a new car. You love that new car smell, new car and everything, new buttons and everything. After a while, like,
I'm over this car. I'm sick of this car. Even your house, right? Like, people can get sick. Like, my father bought a new house that was like same square footage, pretty much in the same neighborhood, and he was just like, yeah, we were just sick of the old house. I'm like, what? That does not seem like the best investment decision. But hey, if you're, you know,
maybe
that just happens.
Or start fresh, something new, you know.
Yeah,
it's
nice. But you got to, you know, be aware of the appeal of something new. So I recently actually read a study that showed that a lot of times people will wander because their partner might fulfill 80% of what they want, and they'll find somebody that fulfills that missing 20%, and then they go for it. But then they forget that that person is missing the fundamental 80%. So you want to be cautious when just trying to find something new.
Kind of like the grass is greener syndrome. And sometimes when you get to the other part, it's, again, the honeymoon phase will also there's a honeymoon phase, and it's going to wear out also. How can we make this honeymoon phase last longer?
Well, the honeymoon period is exciting and intense, but real life is a little more complex. It's messy, sometimes boring, and full of challenges. This doesn't mean that you have to lose the spark with your partner. Instead, it's about finding ways to keep the relationship exciting and sexually fulfilling over the long term.
So what are some examples to reignite the spark?
There are a few ways to reignite the spark. Consider trying new things in the bedroom, like experimenting with toys, role play, or even talking openly about your fantasies. Making sex an event rather than an afterthought at the end of a long day can help keep the excitement alive. It's also helpful to break out of your routine. Plan spontaneous date nights. Try having sex in a new location, or simply make a conscious effort to continue impressing each other just like you did at the start.
And how do you know if it's a natural progression of the relationship kind of maybe dying off, or is it the libido? How do you know the difference?
Well, several factors can influence libido, including medical, individual, interpersonal, and societal elements. Hormonal changes due to aging, pregnancy, or menopause can cause fluctuations in sex drive. Stress, fatigue, self-esteem issues, and even relationship dynamics play significant roles as well. The length of the relationship can also impact sexual desire. Monotony and overfamiliarity can dampen sexual interest, while emotional intimacy tends to enhance it.
Do you have any tips for our viewers to manage the libido changes?
As always, communicate with your partner so that they can work with you and support you. If your partner is experiencing challenges, don't judge and try to understand where they're coming from. You might have to meet halfway or might be creative to make intimate moments happen and maintain your connection, like scheduling sex, redefine sex, exploring different types of closeness and intimacy. If you're concerned about your libido, talk to your doctor. There are a lot of ways that they can help. There are medications, even newer ones for women. Let's take a look.
We do have one drug on the market already that is called flibanserin, and it was approved a couple of years ago now for low sexual desire. It works through different brain chemicals than the bremelanotide. Flibanserin works on the serotonin and dopamine brain transmitters, whereas bremelanotide is working on melanocortin. Both of these drugs are working on increasing those brain chemicals that are excitatory and reducing the chemicals that are inhibitory. Now, bremelanotide is just working on the excitatory end with melanocortin, and flibanserin is working on decreasing serotonin, which is inhibitory, and increasing dopamine, which is excitatory.
If you have a question for Dr. Lia, please send an email to questions@allhealthtv.com. Find out more about sex talk. Go to askdrlia.com.
Dr. Lia, next question. What determines sperm health?
When a doctor is looking at sperm health, they're looking at the quantity, movement, and structure. Fertility is more likely when a single ejaculation contains at least 15 million sperm per millimeter. With mobility, it's about looking at the ability of sperm to move efficiently through the female reproductive tract to reach the egg. At least 40% of sperm should be motile to increase the chances of conception. The more motile the sperm, the higher the likelihood of fertilization. And the structure of a healthy sperm is having an oval head and a long tail.
And Dr. Lia, what can affect the sperm health?
A lot of medical conditions can affect sperm health, like testicular disease, sperm transport disorders, and then there's always age. As men age, sperm motility and normal sperm count often decrease, particularly after the age of 50.
You know, I know smoking is bad for sperm.
Yeah. Bad in general, bad for the lungs too.
Right, any kind of smoking, right?
Yeah, any kind of smoking. Smoking, actually, you know, people just think of it as increasing lung cancer, but in reality, I mean, it increases your likelihood of a whole bunch of different cancers.
Okay.
So.
Cannabis as well?
No, well, there's some studies that are showing the danger of smoking cannabis in terms of your lungs, but research is mixed. Most people feel like no if you're eating it and consuming it, things like that.
And what else should they avoid?
Right. Smoking is linked to lower sperm counts and decreased motility. Excessive alcohol consumption can reduce testosterone and sperm production. Some lubricants may hinder sperm motility. Opt for fertility-friendly options if necessary. Contact with pesticides, lead, and other toxins can decrease sperm quality. Protective measures like wearing safety gear can help with those situations. And high temperatures can mess with sperm production. Consider wearing loose-fitting underwear and avoiding prolonged exposure to heat sources like saunas and laptops.
Yeah, as a matter of fact, those hot tubs are like 104 degrees Fahrenheit, right?
And sometimes you could even hike them even higher than that, like depending on your own settings.
Wow.
So,
Okay.
yeah, not good for the boys.
What do you recommend for healthy sperm? How do you create healthy sperm?
Making small lifestyle changes can lead to better sperm. Having a healthy weight can help with sperm count and motility. Of course, you want to exercise and eat a healthy diet. It's always good. Avoiding STIs and stress can help too.
What about the typical question about supplements and herbs?
Oh yeah, we're always getting those. Well, there are various supplements that can boost testosterone levels and sperm count, although more research is definitely needed. Antioxidants like vitamin C and adequate levels of vitamin D can improve sperm quality, but their effects may vary. As for herbs, there is Tribulus tertiaris, ashwagandha, and maca root. These herbs are traditionally used to enhance male fertility, but their effectiveness requires more research.
Our next question, Dr. Lia. What are the rules for sex when you're pregnant?
Be aware that throughout pregnancy, hormonal changes and physical adjustments can affect your sexual desire and comfort in different ways. Early in pregnancy, fluctuating hormone levels and changes in your body might make you feel more or less interested in sex. Symptoms like fatigue, sore breasts, nausea, and frequent urination can diminish your desire. However, some women might feel a heightened sense of sexuality due to these hormonal shifts. During the second trimester, early pregnancy discomforts often subside, and many women experience a resurgence in energy and libido. The belly is still growing, but still small enough to make sex comfortable, and many women find their desire for intimacy increases during this period. As your belly grows larger in the final trimester, sex may become less appealing or physically uncomfortable. Certain positions might be challenging, and your focus might shift more towards preparing the baby's arrival. It's normal for your interest in sex to decrease during this time.
Let's say their interest in sex is still pretty healthy. What are good positions?
As your pregnancy progresses, the positions that were once comfortable may no longer be feasible. It's important to find positions that are safe and comfortable, like having the woman on top. This position allows you to control the pace and the depth of penetration, making it easier to stay comfortable and avoid putting pressure on your belly. Lying on your side with your partner behind you is another great option. It reduces pressure on your belly and it can be very intimate. And then having the woman on their hands and knees might be ideal. This position is generally comfortable in the first and second trimesters. However, as your belly grows, you may find it less comfortable. You probably want to avoid missionary. Lying on your back can be uncomfortable, and after the 4th month, may put pressure on major blood vessels, reducing blood flow. And just experiment. Try new angles or use pillows for support.
So it seems like sex is pretty safe, right? So
Yeah.
when would a doctor advise against having sex for a pregnant woman?
If you experience significant bleeding during pregnancy, sex could increase the risk of further bleeding, especially if there's a low-lying placenta or a hematoma. Cervical issues such as cervical insufficiency might make sex risky. If you've had early labors in the past or if you're carrying multiples, your doctor might recommend avoiding sex in later stages of pregnancy. If your water's broken, sex can increase the risk of infection. There are a few different reasons, so connect with your doctor if you're concerned.